So next what we need to do is we want to classify decay on the basis of the features. So we have mild decay, we have severe decay, we have mild, we have moderate, and we have severe. So it will be classified on the basis of course we have diabetes. So diabetes we have glucose, and then this ketoacidosis. Acidosis means we'll see the pH, and then we will see ketone bodies, and of course there will be dehydration as well. Let's wait here, take this thoda sa niche. Okay, so in mild the glucose level will be less elevated. The pH will be around, the normal pH of the body is about 7.35 to 7.45. So there will be mild fall, so I can say it will be around say 7.2 to 7.3. Here in moderate it will be about 7.1 to 7.2. It will be less than 7.1, so they are using 1 decimal. The glucose will be mildly elevated, then moderately elevated, then surely more than 200 gram per deciliter, milligram per deciliter will be there. Ketones plus 2 plus on the dipstick, or my beta hydroxybutyrate will be more than 5.3 millimole per liter. And here along with this pH being less, 18 millimole per liter, the bicarbonate will also be less than this. This is the severe one. Here 7.3 will also suffice. So this is what I need to diagnose decay. And obviously dehydration, here will be mild dehydration, moderate dehydration, and of course severe dehydration. Now based on dehydration we'll write the management. The management principally consists of 3 things. We have fluid, we have sodium and potassium balance, then we have insulin. Mild dehydration is basically there will be very less symptoms like mild, moderate, and severe dehydration, like NMCI only it's followed here. So there will be no significant signs of dehydration. Oral fluids can be taken, so we will give oral fluid and subcutaneous insulin. In case of moderate, oral fluids will not be taken. The patient will be in shock, and of course there will be signs and symptoms of dehydration plus vomiting. Then we are seeing sunken eyes, then drinks eagerly, then the skin turgor, dry mucous membrane, everything will be present. Here we will go for IV fluids. IV fluids will be given in 10 to 20 ml per kg in the first hour, rather 20 to 30 minutes time only. And insulin will be of course IV insulin. The dose will be about 0.5 to 1, 0.1 to, pardon me, it will be 0.05 to 0.1 international unit per liter. Now in severe, consciousness will be decreased. The patient might be comatose. Following that, IV fluids again, but this time we will give almost 20 ml per kg per hour. And here other than that we'll give insulin, same dose 0.05 to 0.1. And other than that, some additional measures of treatment will also be taken. We have to monitor the potassium level. If it falls below like 3.5 or something, we have to add 40 milli equivalents per liter NS of potassium chloride. Then we have for sodium balance, basically as we correct dehydration, it itself becomes normal. When the blood sugar becomes less than 300 milligram per deciliter, we need to add 5% dextrose to prevent hypoglycemia due to the action of insulin going on. Other than that, this decrease in sodium can lead to cerebral edema. So what we need to do is we need to slowly correct the levels over 1 to 2 days and not acutely. So this is the management of DKA and classification as well.